Anatomy of female sexual pleasure. The female pelvic anatomy continues to be full of fascinating mysteries related to the stimulation and identification of pleasure zones and the possibility of having orgasms. Knowledge of the female sexual anatomy makes understanding the areas of pleasure sensitivity easier. It helps to achieve higher levels of pleasure and, in many cases, facilitates the possibility of having orgasms. The sexual act and the pleasure zones. This animation shows a sagittal cut where you can see at rest the location of the penis in a coital relationship in the missionary position. See the direct relationship between the anatomical landmarks associated with areas of high sexual sensitivity and the points where some point of friction is generated between the penis and its base with the vulva. The contact points of high sexual sensitivity are all located in the first third of the vagina. They are largely related to the angle and position of the penis in front of the vaginal opening. The other two-thirds of the vagina are not associated with feelings of sexual pleasure. Likewise, it can be seen that the length of the penis does not have much impact on the female sexual response since, in a strict mechanical sense, the length of the penis does not directly affect the areas of high sensitivity to pleasure. On the other hand, the thickness of the penis would directly affect arousal since a wider thickness directly affects the pleasure zones. Surgical procedures associated with functional molding for vaginal narrowing seek to increase the sensation of friction in these pleasure areas by generating a narrowing of the first third of the vagina, seeking greater sexual satisfaction for women as there is greater friction. The clitoris. The clitoris and other organs are associated with the phase of sexual arousal. The clitoris has the sole function of providing women with sexual pleasure. It is as essential to a woman as a penis is to a man. The clitoris is made up of the same tissues as the penis, and for the most part, it functions in the same way as a penis when it comes to sexual stimulation. Some clitorises are as big as a small penis. The main parts of the clitoris. The three main parts of the clitoris are the glans, the clitoral foot, and the clitoral shaft or body. Immediately before a woman's orgasm, more blood pools in the body of the clitoris resulting in a firmer erection, which causes the glans to move up towards the pubic bone. This erection gives the impression that the glans are retracting under the foreskin when in fact, what it is doing is straightening as a result of the concentration of trapped blood. Clitoral erection in the arousal phase, front view. Clitoral erection in the arousal phase, side view. These animations visualize the details presented in the description of the vulvovaginal reaction to sexual arousal, where the process of erection of the clitoris and widening of the vestibular bulbs can be seen. There is an increase in blood supply to the entire vulvar area and the base of the urethra. According to the bibliographic reference of the Atlas of Human Sexuality presented at the end of the video, a relationship of response to greater sexual arousal can be established depending on how close the clitoral glands is to the urethral meatus. The conclusion is reached after a significant sample of analysis among more than 200 patients is that patients where the distance is less than 2.5 centimeters always reached a climax during intercourse. Distances between the clitoris and the urethral meatus and their response to sexual sensations. As a note, clitoris-urethral meatus distance less than 2.5 cm greater sexual satisfaction. Important anatomical distances from the anatomy of female pleasure. The clitoris and the main veins, arteries and nerves as a whole. The glans clitoris has as many nerve endings as the glans penis, just in a much smaller area, which makes it extremely sensitive. Clitoral glans nerve endings are about 8,000 and penile glans endings are about 4,000. Main nerve zones associated with pleasure. In this animation, the areas painted pink, known as the mons pubis, are the upper part of the labia majora. The ilioinguinal and genitofemoral nerves innervate this area. The posterior femoral cutaneous nerves innervate the femoral regions painted yellow. The pudendal nerves innervate the rest of the vulva and perianal skin. Areas of high sexual sensitivity. The nervous system of the vagina is not the same throughout its course. The first outer third of the vagina is part of the somatic nervous system, while the inner two-thirds is part of the autonomic nervous system. There is a region where the two nervous systems are intermingled. This means that the outer third of the vagina is sensitive to a range of sensations. Still, the interior of the vagina is primarily sensitive to pressure and pain. The most complex area of innervation is probably that of the parourethral glands, which in much literature is associated with the so-called G-spot, since the nerves of the vagina, clitoris, and urethra are in very close proximity. This is perhaps why women have indicated that the front wall of the vagina is more sensitive to stimulation. Childbirth, pelvic surgery, and trauma to the clitoris and vulva can negatively affect sexual sensitivity and sensation perception. Summary of the anatomy of female pleasure. To increase the levels of pleasure, the basic knowledge of the female sexual anatomy and its changes in the face of arousal processes is essential. Clitoral erection. The clitoris has the sole function of providing women with sexual pleasure. The nerve endings of the clitoral glands are about 8,000, and the terminations of the gland's penis are about 4,000. The outer third of the vagina is sensitive to a range of sensation. The angle and position of the penis in front of the vaginal opening affect pleasure levels. The inside of the vagina is mainly sensitive to pressure and pain. Women have indicated that the front wall of the vagina is more sensitive to stimulation. The length of the penis does not affect the female sexual response much. The thickness of the penis would directly affect arousal because a wider thickness directly affects the pleasure zones. Irrigation and widening of the anorectal veins. A clitoris urethral meatus distance of less than 2.5 cm is associated with greater sexual satisfaction.